Hello and welcome to today's webinar, Heroes webinar on the C. Everett Koop National Health Award. I'm Jessica Grossmeyer, the Vice President of Research at Hero, and I will serve as the moderator for today's session. In the interest of full disclosure, I should mention that I serve as a board member for the Health Project and also serve as a Koop Award judge. What excites me the most about this award is that it shines light on what an effective, evidence-based wellness initiative looks like, which can inspire and motivate other employers to elevate the quality of the initiatives they offer. So whether you're hoping to apply for an award or not, I think that this webinar is helpful for anyone who wants to understand how to demonstrate an effective health and well-being initiative. Before I introduce today's panelists, I'd like to make a quick plug for the Hero Forum 20, which will convene September 23rd through 25th in Austin, Texas, with a focus on the theme, a 2020 vision for collective well-being. And we'll discuss how group dynamics and social connections shape individual choices. Registration is not yet open for forum, but our call for presentation proposals was out and did recently close March 13th. So we'll be looking through the submitted proposals and we'll be getting back to people with decisions on that in the coming weeks. The forum is relevant to today's session because a portion of the forum agenda serves as the Koop Award ceremony, and there's actually time devoted to recognizing award-winning organizations as part of the forum. As we talk about the Koop Award, I also want to call your attention to our Hero Awards. Unlike the Koop Awards, which recognize exemplary organizations, the Hero Awards recognize individuals who have contributed in exemplary ways to the field. Nominations are open to recognize individuals who have contributed in the areas of leadership in the industry, health and well-being research, corporate leadership, health promotion professionals or practitioners, as well as individual employees or end users of health and well-being programs. Nominations are open until April 30th, and you can find information about award criteria and the nomination process on the Hero website. Now, without further delay, I'd like to briefly introduce our panelists for today's session. I won't go into the full biographies because they are posted on the Hero webinar webpage. However, I would like to share just a couple of remarks about each of our presenters. So Dr. Ron Goetzel will lead us off. He's a founding member of Hero and has long served in leadership roles for the Hero organization, including chair of our board, and is a past recipient of Hero's Mark Dundon Research Award. He also serves as a senior scientist and director of the Institute for Health and Productivity Studies at the Johns Hopkins Bloomberg School of Public Health, and is vice president of consulting and applied research for IBM Watson Health. Most relevant to our webinar today, he serves as the president and CEO of the Health Project. Our next panelist is Dr. Trey McCalister, who founded McCalister and Associates, and has served as a senior consultant and a strategic thought leader, working with employers, nonprofits, vendor partners on U.S. health and care, as well as global health and well-being initiatives. In previous roles at Applied Materials and at Dell, she participated in the Koop Awards as an applicant, and subsequent to that, joined the Health Project as a board member. So Trey represents multiple perspectives as we discuss this award. And last but certainly not least is Sheri Snow, who is a wellness manager at American Cast Iron and Pipe Company, where she has worked for more than 25 years. That's a very unique accomplishment, Sheri, and it might have something to do with the fact that American has been recognized 9 times by Fortune magazine as being one of the 100 best companies to work for in America. Sheri's role includes identifying innovative ways to infuse wellness into every aspect of corporate operations at American. And she also led development of American's award-winning Koop application. In terms of our trajectory for today, we'll begin with Dr. Ron Goetzel providing a brief overview of the Koop Award, including eligibility criteria and examples of past winners, and a bit more about what happens when an organization gets the recognition for the award. Trey McCalister will then dive into a bit more detail on what Health Project judges are looking for in award applications and share some information on recent updates that have been made to the application. You'll want to listen sharply for some of those things if you've applied in the past. Sheri Snow will then share her experience in developing American's award-winning application and also speak to how her organization has benefited from the application process and by being recognized with an award. We'll then move into some interactive discussion with panelists and close with Q&A from our attendees. At this point, I'd like to call your attention to the questions section of your webinar control panel. At any time, you can enter a question into the designated area, and we'll be monitoring those as we move along. We'll address as many questions as we can before the session concludes. And now with that, I'd like to turn it over to Ron to get us started.
Thank you very much, Jessica, and it's a pleasure to be here today to talk about the Koop Award and the Health Project. I think many of you have heard about the Koop Award as being really the ultimate recognition program for companies that have exemplary programs in health and well-being. But not only that, they actually have data to document these programs work. So stepping back, the Health Project, which was founded about 25 years ago with the following mission: to seek out, evaluate, promote, and disseminate the lessons learned from exemplary health promotion disease prevention programs with demonstrated effectiveness in improving employee health and well-being and related business outcomes. So again, it's double-barreled in terms of not only should these programs be improving population health at an organization, but also be recognized as doing so by the senior management of that company as having a business outcome. Next slide. The Koop Award, of course, is named after Dr. C. Everett Koop, who's a former Surgeon General of the United States during the Ronald Reagan administration. And, you know, at this time where we're dealing with the coronavirus and all the other things that are going on around us, it's important to remember many of his major accomplishments as Surgeon General. So he was the Surgeon General during the time that the United States took notice of AIDS as a pandemic. And for his first 4 years in office, as the nation's top health officer, he was prevented from addressing this health crisis for reasons that he says were never really clear to him, but obviously quite political in nature. But he decided, in spite of that, that he would buck the political agenda, and he wrote the official U.S. policy on AIDS. And in 1988, he took the unprecedented action of mailing this AIDS information to all U.S. households. Over 100 million households received evidence-based information about the AIDS epidemic. And of course, people on all sides of the political equation there either promoted or protested this move, but it obviously made a huge, huge difference in this country's commitment to battle this epidemic. And we're now in a similar situation where public health and leadership from public health is really so important in dampening this epidemic that we're all experiencing. Next slide. So back to the Health Project and the Koop Award. So we're dedicated to recognizing private and public, and by the way, questions have come in whether this is US only. No, we actually do receive and review applications internationally from international organizations. But we're looking for programs that measurably improved, let's go back a slide, that measurably improve the health and well-being of people and done so cost effectively. So cost is a factor in the review and determination of winners of the Koop Award. So the employer-based programs have the following objectives. They have to improve population health by helping individuals change unhealthy behaviors, reduce their health risks, establish a culture of health at the workplace and surrounding community, essentially the undergirding for all of the organizational programs, and offer good value for the money. That money is spent investing in these programs, that actually the money is well spent. Next slide. So to be recognized, a program must employ a comprehensive evidence-based population health management program designed to improve the health and well-being of the entire population, not just a small sliver or subset, across the health continuum. The program needs to be in place for a minimum of 3 years, needs to be well integrated into the organization's infrastructure and yield significant improvements in population health and noteworthy business results. Now, what does that mean? What do business results mean? Well, it can be and has traditionally been medical cost savings, but it can also obviously include things like reduced absenteeism, fewer accidents, increased worker productivity, or other improvements that the company feels falls under the broad banner of value on investment. Next slide. So basically, you can narrow down the criteria for winning the award by answering the following three questions. What is the program? What was done? Did it work? And was it worth it? And as Trey is going to talk about in a moment, judging is weighed very heavily, 60%, on documenting the outcomes of the program. So you can have the most marvelous program with the greatest brochures and really excellent things that are being offered, lots of resources, but unless you have data to document that the program actually achieved its outcomes, both in terms of health improvement and business objectives, then it's not going to win the award. You need to have both, obviously, but much more of a heavy weighting on the outcomes data. Next slide. Here are examples of some recent winners. They include Baylor College of Medicine, Erickson, which won last year, Boise, Idaho School System, BP America, Dell Technologies, and last year we also had an honorable mention of a healthcare system in the Middle East that won an honorable mention award. And you can get all the information about winners. In fact, there are complete applications by going to our website, thehealthproject.com. Next slide. In January this year, Jessica Grossmeyer and Sarah Johnson put together a special issue of the Art of Health Promotion focused on best practices. This was determined through a series of benchmarking reports, but then also featured three winners, or honorable mention winners, recognition winners of the Koop Award. We're going to hear from one today, American Cast Iron and Pipe Company. Also Delta Airlines, Kaiser Permanente, and LG&E KU, which is an energy company in Kentucky. And what we have in this special issue is a write-up of those programs and insights as to how they leveraged and applied best practices in order to get recognition from the Koop Award. Next slide. So again, each year we bring the winners and honorable mention recognition awardees up on stage, and they receive the Koop Award. Here on the right-hand side, we have a picture of some of the board members, and if you go to our website, you'll see that we've put together a really impressive group of reviewers for the Koop Award. They include academic researchers, medical directors, people who've been in the industry for many, many, many years, all of whom individually review each application, score those applications, and then we get back together to discuss the scoring and who ought to be the winner that year. And next slide, and I think this is where I turn it over to Trey.
Thank you, Ron. And I would like to provide a brief overview of the application for the C. Everett Koop Award. And I'll be covering what's included in the award, but also just want to remind the attendees that all of this information can be accessed at www.thehealthproject.com, and we will pull up that URL link for you and a snapshot of that page to show you exactly where to find it on the page. So the first part of the application for the C. Everett Koop Award is asking for the applicant to describe the program background. So the program description, what program's in place, and as part of that, including content around what the leadership commitment is, how does the organizational culture support the health and well-being program, what aspects of planning, communications, marketing, and all of those components are asked to be included in the program description, along with integration, benefits design, and then also how the data is managed. Another section which is included as it relates to the program background is the applicant should be including how a description of a comprehensive approach to the program design, how they identify the opportunities to improve health and well-being in the organization, and how the program is designed to reach and improve health of the entire population, not just those who are at risk, but those across the full health continuum. And then in addition, in this section for the program background, the applicant should also include an overview of how the program is integrated into the overall organizational structure, how it aligns with the vision, the mission, and the purpose for the broader organization, and the overarching company business goals. Jessica, if you can proceed. The second section of the application includes an opportunity for the applicant to expand upon the evaluation methods and results. So specifically, the applicant should include a description of what strategies are employed to improve the health of the population, what are the top health issues that are being addressed, and what evidence of health improvement exists across the population. The program evaluation methodology and results should be highlighted here, as well as the connection between the measurable outcomes and specific program elements. It's in this section where we ask the applicant to document and demonstrate improved health or risk reduction, or whatever it is that the organization is looking at in addition from a business outcomes perspective to demonstrate the value that the health and well-being program is delivering. Some examples include whether that's driving medical cost savings, reduced absenteeism, improved worker productivity, improved attraction, retention, or job satisfaction. What's really critical in this section, and what the judges are looking for too, is a clear story of how the data demonstrates where the health needs are for the entire population, how the program is designed, and ideally whatever tables that are included to demonstrate health improvement or linkage to business outcomes. They need to all be labeled with total number of eligibles, participants in cohorts or subpopulations, and each of those titled and each of the pages numbered so that the judges can really follow along the story that the applicant is painting as part of the application process. Next. There's a new section that we're excited to highlight in this year's application, and it's looking at what organizations are doing around innovation. So there is a section where applicants are asked to describe their innovative approaches taken and how those approaches have contributed to the success of the program. So some examples of innovative initiatives that we've seen in past applications include perhaps use of technology to drive personalized or targeted outreach, engaging higher risk populations, and how those might lead to high levels of participation and health improvement. Another example would be in an application where an applicant highlighted how their well-being initiatives were being driven through diversity or affinity groups. For example, this particular applicant had a high population of Hispanics, and that population was more at risk for diabetes. So how they created a communication initiative to engage that population and target those high risks, and how that demonstrated over time health improvement. So those are a few examples of the innovation section, but we would like for you to highlight as the applicants what you're most proud of in your organization as it relates to your programs. So I had referenced earlier the web page that you could go to find out the details about the application. That is www.thehealthproject.com. The applications are due on May 15th. And so you might wonder, after you submit the application, what the process is that the Health Project Board goes through. Each application is independently reviewed and scored by each board member. Then the board member comes together as a selection committee and selects those. We review each of those applications and selects those that are then identified as honorable mention or C. Everett Koop Award winners. That determination is made during the board meeting, but every applicant receives reviewer comments, and those are made public and can be found on this website so that ideas and lessons learned are shared on each of the applications with others. and each applicant receives their own form with those reviewer comments so they can see what the strengths and where the opportunities are from the perspective of the selection committee. Let's move forward and show what that page actually looks like. So if you go to that web page, this is the www.thehealthproject.com. This is what you'll see. At the top is the information around the award, the first red button, Apply Now. There's additional information on the award's criteria. We're excited this year to make it even simpler for any applicant to apply. We've created a one-page checklist, which any of the applicants can access, and we encourage you to do so in advance. It outlines the requirements for the C. Everett Koop Award. So by looking at it, you should be able to quickly see whether your program is ready to apply or whether you should potentially wait and apply perhaps in the following year. And with that, I'd like to turn it over to Sheri Snow to talk about a case study from American Cast Iron Pipe Company.
Thank you, Trey. I'm happy to be here with you and Jessica and Ron and all of you that are listening to share a little bit about our journey in the Koop application, and we were very honored to be recognized as a Health Award recipient in 2014. I've been the wellness manager at American Cast Iron Pipe Company in Birmingham, Alabama. I've been with them for probably more than 20 years now, in my current role for about 12. American's been manufacturing goods for the waterworks industry since 1903. We manufacture ductile iron pipe for the waterworks and sewer operations and steel pipe for the oil and natural gas industries. I manage a contracted team of dietitians and health coaches, and together we're fortunate to be able to provide programs and services and resources for almost 1,500 employees in Birmingham, as well as their spouses and dependents, so around 3,500 in total. We're able to offer on-site physical therapy. We contract with the local vendor and pay them directly. We are providing an early intervention program for injury prevention. We have a diabetes education program that's recognized by the American Diabetes Association. We offer tobacco cessation, nutritional counseling, chronic disease management. We have an on-site fitness center. And then we also offer a couple of screening and health coaching programs with incentives available for employees that participate. And I'll talk a little bit more about that in a few minutes, and that is what we based our application on. I also serve on American's strategic healthcare team, and that's a multi-stakeholder team that explores and makes recommendations on a lot of different topics related to healthcare benefits for our employees and their families. And really that's just a snippet of a long history of taking care of our employees. Our company has always been of the philosophy that our employees are our most valuable resource. And so it's really been all about doing the right thing from the very beginning. As you see on the slide, if you're looking at the slide deck, American the Right Way, that's always been their philosophy, doing the right thing for our customers, our employees, and with our products as well. Our program is called the Well Body Program, and we started in the early 1990s with on-site fitness classes and on-site weight loss, really at the request of our employees through a survey. And then later in 1996, we started our signature screening and health coaching program called Well Body Club, and it's a voluntary health risk assessment. It incorporates some goal setting and coaching, and we actually go out into the plan and deliver it to the employees at their work area. It's really a cardiovascular risk assessment. We collect their height and their weight, blood pressure, body fat percentage. We ask questions about their tobacco use and exercise, and then we collect their blood work results from their primary care physician just to make sure that we're connecting them with preventive care. Our coaches work with them to set goals, and then we try to create other opportunities for interventions by enrolling them in programs to help them make improvements to that with the things that we've identified in that assessment. Their results place them in one of 4 health clubs, and that equates to their health risks. And again, as I mentioned, the health coaches then try to help them move from a lower health club to a better area of risk, or a higher club, and then they're eligible to receive a cash amount for their club status or their health risk status. And then the second layer of that program is with regards to goal setting. If the participants meet the goals that they've set, they can qualify for a discount on their monthly medical premium. It's all voluntary. It's open to all employees, and they can participate on company time. So our management's been very supportive of that, very vocal and visible in their support. We've seen some great outcomes from our on-site physical therapy program. We started initially just providing therapy for patients that had work-related injuries in an effort to get them back on the job as quickly as possible. And now all employees can have physical therapy at our on-site clinic at no charge. Again, we saw such an improvement and a reduction in, or such an improvement in productivity. They don't have to clock out and drive across town to have their therapy. They can just basically walk across the parking lot, and then again they're back to work as quickly as possible. Our contracted vendor is very much a collaborative partnership. They provide pre-work physical evaluations for us, do ergonomics assessments, and then also return to work evaluations. And investing that with physical therapy and also our safety program has really paid off in terms of integrating all of health and well-being, safety, and then physical therapy and rehab. So you might wonder why we actually started this journey, or why we decided to apply for the Koop Award. And while Americans always placed a really high value on employee health, we've done that since the early 1990s. We knew it was a smart business decision, but we really wanted to know if there were gaps in what we were offering, and if we were, meeting the standards in terms of benchmarking. They weren't really asking for recognition, but we wanted to know, were we doing the right thing, and how could we continue to have high levels of participation and engagement. So we found out about the C. Everett Koop Award, and that it really is the most significant prestigious health award that you can apply for. Our president, in his acceptance speech, called it the Super Bowl of wellness. So we knew that the application process would be very rigorous, and it would take more than just management support and engagement. And we knew that we would have to demonstrate some significant changes in health risk, as well as that cost savings that Ron mentioned earlier. And we really wanted that kind of review from all of the experts in the profession, the thought leaders that are out today. So all in all, I think the process was very beneficial. We did receive some great objective and constructive feedback from the reviewers with the health project, and we're always looking for ways to improve and to expand. And the scorecard also was a really valuable tool for measuring and ensuring that we were incorporating best practices, and then, as I mentioned, identifying gaps that we could focus on moving forward to continue to grow and expand and incorporate more innovation and creativity in reaching our population. Secondly, the process encouraged a lot of integration with stakeholders all throughout our organization, and that really has elevated our efforts from just being a health and well-being program to one that is actively participating in a corporate health strategy. And then finally, we were really just honored to receive the recognition. While we've always placed a high value on health and well-being, the Koop Award really reinforced that and validated that we were doing the right thing, and it was an honor that came with a prestige that our management and our employee population reacted to and felt really deeply. And it's not to say that other awards aren't meaningful, but the Koop National Health Award is rigorously reviewed, and it really provides very critical and relevant feedback. So when we made that decision to apply for the Koop Award, we had been collecting data for years and years, and The process that we went through started with an integration of data, including the demographic data from human resources, of course our health and wellness data, data from our safety department, our absenteeism, and then also our healthcare cost data from our third-party administrator. And we partnered with a healthcare consultant and a local university to complete that integration and analysis. And we wanted to explore it from three aspects. And the first is, what is our participation and then sustained engagement over time, and then also engagement of the same people. And then secondly, what was our health impact? What was the reduction in those health risk factors and improvement in those health clubs that I mentioned, as well as improvements in individual indices like blood values and exercise and blood pressure. And then finally, a comparison of our participants over time, as well as a comparison of participants and non-participants on healthcare costs and productivity, which we measured initially by time away from the job due to illness. So with that, I'm going to turn it back over to Jessica. I'm happy to answer any questions.
Okay, great. Thanks so much, Sheri, Ron, Trey, for your information and for sharing with us. I'd like to start by providing just a few questions that I had, but then we do have some questions coming in on the platform. So for those of you who are putting questions in, I'm seeing those and continue to put those in. Ron, I'm going to start with you. Trey mentioned that the application process welcomes results based on business impacts. Can you provide an example of what you mean by business impacts, and how does the return on investment or value on investment approach come into play?
Yeah, all right. Well, when we first started the program back about 20 some odd years ago, the criterion for winning was actually demonstrating cost savings. And we've learned over the years that it's very, very, very hard to document cost savings. There have been studies done looking at the impacts of these programs on healthcare utilization and even costs and even establishing return on investment. But they're complicated studies to do, and they're hard to document. And so when we look at business results, it's really what the business values. And today, that can certainly mean healthcare cost savings and reductions in workers' comp costs and disability and absenteeism, but also measures of productivity. There may be measures of engagement in your work, attraction, retention of talent. There may be a variety of different things that the employers are now looking for in terms of business success and business results. And all we're asking for is essentially what the employer defines as a business metric, as a business success, assuming it's a valid one and people would agree that's a good thing to do. But we've moved away from having to document and demonstrate a pure ROI to one that's value on investment, and value can be defined in a whole variety of different ways. As long as it's credible, we'll look at it and consider it, even when you're not actually able to pinpoint cost savings.
Great, thanks so much, Ron. Sheri, I'm going to go back to you. When it came to deciding, you had so much data to choose from, and you had some really good partners to help you dig into the data. And the Koop Award application just lists some examples of what types of outcomes that you might look at, and Ron just mentioned some more. How did you decide what was important to measure in order to document your achievements with Americans program?
Sure. In the past, we had seen a significant difference in both cost and health risk associated with our health clubs. And those clubs, we have named them Club 10, 25, 50, and 200. Our Club 10 participants have the highest health risks, and their healthcare costs followed and were the highest. And Club 200 are our healthiest employees, also with the lowest healthcare costs. And because we had been able to have good engagement over time, we wanted to look at changes in health risk and health cost from a time 1 to a time 2. And because we've had that engagement, we could actually compare an apple to an apple instead of just looking at it from a population standpoint. So when we looked at the changes from baseline to a participant's second evaluation, we found an overall 9% reduction in health risks. And then we also saw some risk migration. For example, 92% of participants in the moderate risk group moved to the lowest risk group. And then 83% of those in the lowest risk groups, or our healthiest category, stayed in that lowest risk group. And then also, of those in the highest risk category, 87% improved. So what we saw is that as people got in the program and they stayed in the program, they did have some significant changes with their health risks. And as we mentioned earlier, because we're required to not only show that impact on the population health status, but also the business impact. We did look at healthcare costs, which have an impact on profitability, but also on productivity, and we looked at that through absence reduction. So, for example, again, individuals that were in the moderate to the low risk group had only a 6% increase in healthcare costs over that 5-year period that we looked at. Those in the high risk group had a 9% increase over 5 years. And our non-participants had a 12% increase over 5 years. And so we did do the numbers and look at the business impact, and for every dollar invested, we saw a return of 1.71.
Great, thanks so much. Oh, go ahead.
Sure. Oh, no, I was just going to just mention one other thing. The third thing is when we looked at absenteeism and productivity, the ones in the moderate to low risk group were absent about 5.5 days per year. In the high risk group, 13.5 days per year, and our non-participants about a little over 10 days per year.
Those are just fabulous results. And I think one of the things that really stands out to me as I consider the approach that you use to demonstrate impact is it wasn't just looking at outcomes for the whole population, but the fact that you were using these cohorts, these different groups, and comparing them against one another, you were able to tie, the program design to the health changes, to the outcomes, the cost outcomes. And I think that's one of the things that having been a judge just for the past couple of years really does stand out is, can you connect the outcomes that you're seeing back to the programs and services that were offered? And the example that you just provided, I feel like is a really clear demonstration of how to do that well. So thank you. Trey, I'd like to talk a little bit more with you about your experience as an applicant for the award, particularly in your experience with Dell. Could you share with us a little bit about that journey, what you learned along the way, and what recommendations you might have for others?
Sure, Jessica. I have had the opportunity when I worked on the employer side to apply for the C. Everett Koop Award with 2 different organizations, but applied 3 times and with 2 successful Koop Awards. The more recent experience at Dell in the 2011-2012 timeframe, we applied initially as a team to try to see how we could do on the application. And the application actually at that time when we were at Dell received honorable mention. And that was a little bit of a exciting, but also, a little bit frustrating experience in that we almost got there, but we didn't have quite what we needed. But what we were able to glean from the reviewers' comments when we received honorable mention really helped us to think about what we needed to do to round out the application process, and even our program intervention approach to really highlight in the following year, 2013 application, a stronger application which was really highlighting not only the business success of the program, but the health improvement across the entire population, and that allowed us to present a stronger application in 2013 based on what the reviewers' comments provided us and that feedback. So we did actually win the award in 2013. So having been through that process on the applicant side, I can tell you that the judges take each review of each application very seriously, and it is an independent review. So since that time, going through the process and reviewing applications, I have a great appreciation for the effort that the applicants put in. And I will say that it really does help. If you go through the process, you do get the feedback from the reviewers, and many companies have taken that and applied a second time and improved their application in that second process. And it's presented a stronger application like we did when I was at Dell.
Yeah, you know, Trey, having just been a judge for the past couple of years and seeing the significant discussion that happens around these applications and the feedback that's provided back to the people who apply, I've been really impressed with just how much people get back. So even if they don't get recognized, there's all sorts of ideas about, here's some ways to strengthen your program, here's a strategy you might try, here's the way to approach your evaluation maybe in a little bit stronger way. You know, I've always thought of it as people are getting free consulting from some of the best in the industry. I don't know, would you agree with that assessment?
Absolutely. I know the industry leaders and both really from the employer side and then also from research and academia on the board that are part of the review board for the application process all bring something different to the table and have been in this field for quite some time. So I would say absolutely. The comments that they provide on each application help the applicant to know how to even improve their program moving forward.
Yeah, thanks so much for that, Trey. It's just brilliant perspective. You know, Ron, if you wouldn't mind, I'd like to pose a question to you. As a researcher, you know, we know that some of the organizations that have applied in the past have subjected their results to peer review and published their results in a research study in a peer-reviewed journal. In your view, what are some best practices for how to use publications as part of the application process? And do you have any guidance on how not to use those research studies as part of the actual application itself?
Yeah, and I commend organizations when they have gone the extra mile and published their results in scientific journals. What often happens, not often, sometimes happens, is they attach those publications as an appendix or as additional documentation to the application. It is not a requirement. It is not required that you have published research. It is kind of a nice extra touch to the application, but each application is reviewed in terms of its internal validity and the data that are presented in the application itself. What we don't want to see is essentially a copy and paste type of situation where if you've written a report or even had a publication that you just copy that and insert it into the application and you think that you're done. That's not sufficient because you're not really satisfying the requirements of the application and all the different issues that are being asked for. But if you do have publications from your work, and we've obviously had that on several occasions, that certainly strengthens the application because reviewers can then even cross-reference what's in the publication and what's in the application.
Great. Thanks so much for that, Ron. I appreciate that clarification. Sheri, I'm going to go back to you. What did you think was the hardest part of the application process of itself? You know, what did you find to be the most challenging part of it?
Yeah, I think really truly understanding the application, which is why I'm so glad you guys are offering this webinar. As a practitioner who has a nutrition, I'm a dietitian, nutritionist, I had statistics in college, but really having to sit down and understand what we were being asked to complete was a little bit daunting at first. Of course, making sure that the data was available in the right format and that it was clean, and of course, making sure that we described in very small word count the true story of our program and our company. I think pushing that application submit button was hard, just to, when it came down to it, to make sure that we had done a good job of telling our story while also sharing what we felt to be, significant impacts on our health, the health of our population.
Yeah, you are looking at a blank page with some guidelines, and I think it can be really helpful to go out to the website and see how did others approach this application. The winning applications are all published out there, and I think it can be really helpful guidance for people to see, well, how have others approached this? So would definitely commend the website to folks. Trey, you've been through the application process several times, as you mentioned, on behalf of organizations, but now you're judging the applications as a health project board member. You've been doing that for several years. What have you learned about the application process based on your experience on sort of both sides of the application?
Well, on the side of the applicant, I think one recommendation that I would make, both having been an applicant and then now also having judged the award process for a number of years with a number of peers in the industry that are part of the board, I would recommend that if you're applying, once you complete your outline, meeting the requirements for the application, which again, we've tried to make easier this year with the checklist, quick one-pager that you can look at that should guide your application process. If you take an extra few days to ask a couple of peers within your company who may not know the details about the program, or even a colleague, to read the application through and ensure that it really tells the story that you want it to, and that all of your data and tables that are part of the application are supportive of the description that you're including for the program and the evaluation and your results, that is a helpful process to go through to ensure someone who hasn't been a part of the application process can read it and understand and follow the story that the applicant's trying to tell in their application. I think it's a great recommendation to consider. And I think from being on the judging side, I would say I can usually tell in reading applications when someone's taken that extra step just to try to have a colleague read the application before submitting it. Helps to make sure that the story really holds together and supports the objectives of the program, and that the data supports all of those things. And when the reviewers read it, they will see that as well. And that makes, I believe, a really strong application.
If I could ask you a follow-up question, Trey, you've been through the application process, as you said, several times, and Sheri, I'm coming to you with this question next. Fran Scott just asked, how long did it take you to actually complete the application? Once you, from the start of preparing and pulling the information together and the time that you submitted, was that months? Was it weeks? Can you give us a sense, Trey? And then Sheri, we'll go over to you.
Sure. In the 3 times that I went through the application process on the employer side, I would say gathering together the information and collecting the data. Fortunately, it was something that the organizations that I was a part of it was a part of a process they followed throughout the year, so that getting participation data, looking at top health risks of the population, and the programs were based on those things. So pulling that data together certainly took a little bit of time, but less time because we did it on a regular basis to ensure that the program was designed to be improving the health of the population along the way, and looking for opportunities where gaps exist to improve the program. So we had that data, but pulling it together takes a little bit of time. I would say a couple of weeks for sure. And then the actually writing the story and filling out the application, I would say probably, you know, not something that was done all at once, but another probably week. So I don't know if you feel like that's fair, Sheri, or not. Would love to hear your input, but maybe a 3-week process.
Yeah, I think probably for us it may have taken just a little longer, just because we did have a lot of internal review with stakeholders, and we got a lot of input on actually completing the scorecard, which I think was really helpful because it, you know, it sort of got everyone on the same bus, so to speak, and you know, getting the data wasn't too difficult. But I think the analysis and actually trying to figure out, again, if we were really telling the story, probably took a little bit longer with us. It was the first time we had done it. So it really did take a little bit longer. I would say I would probably allow at least 6 months if you're thinking about it. And then it's always great if you have time to spare.
Yeah, thanks for that. And you know, it is a best practice, a recognized best practice, to be doing ongoing evaluation of your program, keeping on top of that data, as Trey said. And you know, applying for the award isn't the time to start evaluating your program, I think, is one of the messages I'm taking away from this. It's something you want to be familiar with your data, keeping an eye on it, and then when you go to apply, it's really just pulling that data together, the information, into a cohesive story. Ron, I'm going to go back over to you. This is a question that came in from the panel. The winners that are on the website that have been described appear to be employers. And, you know, can you help us understand how wellness vendor suppliers, providers of services, might participate in this process? You know, can they apply and highlight the success of one of their clients?
The answer is yes, but the client needs to apply. The vendor supplier can support that application. And most of the applications we receive usually do have suppliers, vendors, consultants, and others involved in some form or fashion. You actually have to disclose that as well. But it's the organization that is applying for the award, not the vendor providing the services. And so that's the caveat there. Is you've got to have an organization that is applying on its own behalf, with support perhaps with suppliers and vendors on that application.
You know, just a follow-up question to that, Ron. You know, I'm always reminding myself, vendor suppliers are employers too. They have employees. Have you ever had an organization that provides wellness services to the industry apply for a Koop award as part of shining light on its own efforts to improve health and well-being for its own employees as a service provider?
Yeah, actually, we've had a number of hospital systems out there. We've had Kaiser Permanente apply. We've had other health plans apply. I think Aetna actually was one of the first winners of the Koop Award. So certainly insurers, providers, health plans, hospital systems, as long as they're applying on programs that benefit their own workers.
Great, thanks so much for that follow-up. Trey, I'd like to go back to something that you said, but you know, if you want Ron to answer this first, you know, you guys can decide. But one person asked, Ron, when you had talked about the eligibility, you said that in order to be recognized, a program must employ strategies designed to improve the health and well-being of the entire population across the health continuum. But then Trey, in your presentation, I think it was when you were actually talking about the innovation section, you mentioned an example of a program that was just for individuals with a Hispanic background who were diagnosed with diabetes. So if an application focuses just on diabetes education, even if they're saying, well, anybody who has diabetes can take part in this, but really you're only eligible if you have diabetes, you know, is that an example of a program that we would want to highlight on an application?
So Jessica, I'll take this first and then I'll ask Ron to chime in as well. Yes, that specific example I provided was when with the new section on the application addressing innovation and asking the applicants to describe what they do with innovative approaches that they've taken to contribute to the success of their program. I gave the example, and it's just one example, of what one employer who happened to have, as a manufacturing population, they happen to have identified that they have a lot of Hispanic employees, and they employed an approach to engaging those employees through their affinity groups. So those organizations that have programs in place to reach out to LGBT or Hispanics or Black or women, gender-specific affinity groups, this particular organization actually reached out through their Hispanic affinity group and outreach through that program to engage their employees that were part of that organization in a program to address diabetes, since that was one of their top health risks. So that was an example under innovation, but I would say the overall application needs to provide and describe a comprehensive approach to program design, which really includes opportunities for the entire population to improve their health and well-being, not just one specific. But it's quite okay to list a case study or a specific example of how you've brought in innovation to reach or engage a certain part of your population. Ron, anything you'd add to that?
Yeah, no, that's absolutely right. And again, what we're trying to guard against is an organization saying we had a diabetes program and that's all we did. Or we only targeted people with hemoglobin A1C above a certain level, and that's all we did. We want to look at, if you have 1,000 employees, we want to look at the impact of the program on the 1,000 employees, not just a specific subset.
Great, thanks so much for that clarification. Sheri, you had mentioned that you used a scorecard or mentioned a scorecard as part of your application. Can you help us understand which scorecard you used, and was that something you found on the Health Project website, or how did you get access to that scorecard?
Sorry, that was the HERO scorecard. Yeah, and I think it's just on the website, and it's really just a comprehensive, almost a checklist of, what you have going on at your work site, what you're offering, what some of your environmental policy, just things that you already have in place, and of course the ones that you don't, just really provide areas that you can work on.
Yeah, so Ron, having a scorecard is actually part of a recommended aspect of the application. Can you speak more to how that fits into the application process?
Yeah, we recommend that people include results from an organizational scorecard. The HERO scorecard is one. It is free. It's available. It's on the HERO website. The others that are available, CDC has a scorecard called the CDC Worksite Health Scorecard. Again, available free of charge from the CDC. And then the American Heart Association also has a scorecard called the Workplace Health Achievement Index, again, free and available on the American Heart Association. And there are a few others, but those are the main ones that employers can go to. And as Sheri said, that's a checklist of things that are evidence-based that underscore and undergird an effective program.
Great, thanks so much for that response, Ron. We're going to do one more question, and it's, I think for anyone, I think either Trey or Ron especially, but how do requirements maybe differ for small versus large organizations?
Yeah, I'll start. I mean, big, heavy data and analytics are typically can't be done by small organizations. They usually don't have large databases, large warehouses, researchers available. So we look at common sense issues. So for example, if you're saying we were able to improve the risk profile of the population, give us information about the number of people who are obese or smokers or have high stress, blood pressure, cholesterol, and those are typically available from health assessments of some sort. On the cost side, the business side, sometimes your healthcare cost trend has been lower than industry average, and that may be an indication that you're actually bending the cost curve, and that may be suitable for a small business to present those kind of data. If you're a very large business and you have a lot of data and access to those data, typically we would like kind of more rigorous evaluation of those data, and that may involve, in some cases, heavy-duty experimental or quasi-experimental studies where you have treatment control populations and so forth. But again, for small businesses, the requirements are much more real-world oriented.
Great. Well, thank you so much for that. And with Ron, with that response, we do need to conclude today's webinar. Thanks everyone for joining us. Thanks for your fantastic questions. Ron, Trey, Sheri, thanks so much for coming to share your experience with us. And with that, I bid you all a good day.
Thank you.